today I really want to dive deep in myopia, and I want to just kind of start from the beginning and just really discuss what is myopia, right? Because there's a lot of folks out there that may keep hearing this buzzword but have no clue what it's truly about. So if you don't mind, just taking it from the beginning, and we're going to kind of evolve from there.
Yeah, well, so I think we're all very familiar with myopia being this thing that is nearsightedness. And the tough part about myopia is that it really is much more than a refractive error. Um, and that's been what we were all taught in optometry school. But the reality is that this is a disease that is a progressive condition.
Absolutely.
It's chronic, it's progressive, and it leads to degradation of tissue. We That's a disease. And so our definition of myopia is no longer that it is, this condition that causes blurry vision, but that's one of the symptoms of it. It is a disease that causes eyeball elongation, resulting in reduced vision, progressive vision loss, and increased risk of disease. And that's what myopia is. We see that as people's prescriptions that are increasing, but where we really see this as the downfall of so much in eye care is what happens at the end of life because of the decisions that we've made throughout life, which is what really is happening with most disease, like diabetes and so forth, right? Preventable,
Yeah.
and we just have to take the right steps to do that.
Well, the one thing that I love that you mentioned, and you said it so many times, and I hope everyone caught it, is the word disease, right? I
It's
mean, when you
true.
bring that into the picture outside of just a refractive error, that really changes the game. That really changes the conversation. And that really gets everyone on alert like, oh, disease? I don't want a disease. What should I do
Hmm.
about this? Please educate me. Tell me a little bit more. So, what I would like to do next is really just, talk about, why should eye care professionals care about myopia? Why should we be having this conversation in the exam lane? I mean, clearly,
Yeah.
knowing that it's a disease should make every eye care professional have this conversation. But for those that have been living under a rock and not having this real conversation with their patients, why should they even care?
Yeah. Yeah, so the definition needs to change, and that's exactly what we hit on. I'm going to say it again. It's a progressive disease that causes eyeball growth, resulting in higher disease risks, blurry vision, and changing prescriptions. So, to answer your question, I want to talk about my patient whose name is Steven. And
Okay.
he had seen me for years and years and years, and is one of those guys where it was like, when we first started in practice, we remember those patients with weird prescriptions, and he was that guy with the -14.
Wow.
Saw him every year. Never could I convince him to do contact lenses, but he just had thick glasses. And, I just remembered this guy, and, we saw him. And then he had cataract surgery, and his life changed,
Yeah.
right? His life was completely revolutionized. I remember the smile on his face when he came in for his post-ops, and it's really helped this guy. But guess what?
What's that?
His risk for progressive disease did not go away because he could see better, right?
Mm,
For all intents and purposes, what we used to think of myopia was cured by his cataract surgery. He didn't have this nearsightedness anymore,
right.
but he had eyeball growth, and now he is having retinal disease, macular disease, and he's being followed on a yearly basis for glaucoma progression. He's 63 years old, so he's a young guy, but he has this. And so it made me think, Daryl, who are the little Stevens in my
Mm,
practice? And we wait for the end of life for us, and not, I don't mean end of life, but older in life, that
right.
we're treating and managing these progressive disease patients. But what are we doing to turn the spigot down? What are we doing to
Yeah.
shut that off so it doesn't happen? And my challenge to eye care providers, if you don't think this is a disease, is to look at your patient population that you're managing: glaucoma, macular degeneration, retinal disease, things in the back of the eye, early cataracts, right?
Yeah.
And ask yourself, what is these patients, what was this patient's refractive error prior to cataract surgery, or what is their refractive, error right now?
Yeah.
And I guarantee you'll see this huge trend that most of
Yeah.
them are myopes, right? And
No doubt.
the other thing, Gerald, is when I was in optometry school, I was celebrated as being, this -1 myope, right? For this beautiful thing of once I turned 40, which happened a couple years ago, that I was going to get to see up close and not have to wear reading glasses. I like had the perfect prescription. Guess what? My risk for glaucoma is 2 times greater than the person who is an emmetrope sitting next to me. Who of us would say, I'll take a 2 times greater risk of a disease that could cause vision loss? None of us would do that, right? But we've just historically looked at myopia as just being a number, not a risk factor, and it is.
And I love that you're talking about the impact of myopia, right? Like you gave that scenario, right? But there's tons of people in the world. What is that going to do to the future of the workforce, the future of, our kids? How's that going to impact the future of folks when it comes to myopia not being controlled or managed? I mean,
Yeah,
this is very scary
pretty
stuff.
big.
Trying to think about it, my friend.
It is pretty big, so here to give you some numbers. Singapore, 75% of the population is myopic. We go up to Hong Kong,
Gosh.
80% of the population. In mainland China, it's about 90% is myopic. In South Korea, 97% of the population is myopic. And in
Mm,
the United States, it's getting close to 50%.
wow.
So, think about this. If is China is seeing this as a major concern because of the future of their military. They're going to run out of people that they can have be fighter pilots,
Oh my
unless they
goodness.
change the protocol for that. If we look at our population being 50% myopes, and the 50% has a 2 times greater risk or higher, we're not even grasping what's going to be happening with regards to refractive error and so forth.
Right.
And we're talking about the disease component, and that's impactful for practitioners, but for the patients who are out there, right? We can't always just scare the patient to being like, hey, you're going to have this disease. We need to stop this. The real
Right.
impact for a kiddo, and I think about this as I go swimming with my little girls all the time, right? Is if you've got a 3 -2, 3, or 4, you can't see who is across the swimming pool.
Right.
And I'm swimming with my kids, and we're playing across the swimming pool with each other. Refractive errors have a huge impact on our quality of life from the perspective of playing and interacting and doing sports,
Right.
functioning in music and so forth. And so there's a quality of life impact that goes towards this myopia. And we're just talking about general myopia. We're not even talking about high myopia
Right.
for patients. And that's where it really becomes difficult. But even just generalized myopia, as you and I both know, is a pain in the butt,
Oh yeah.
let alone these disease risks that are out there, right?
Yeah. It's amazing to me that, this problem's been around for a while. We've been just kind of twiddling our thumbs more than anything, right? And I'll be honest, when I first got out of school, I paid no attention to it. And am I one of those doctors that, do ortho K and a lot of atropine? No. But if there's something that I can handle with my MySight lens, I do it. If there's something that I can't handle, I refer to one of my colleagues over in my organization and my eye doctor that's a myopia expert, right? But I don't just sit on it, right? I make sure
Yeah.
that I make a change, I make a shift, and I put that patient in the right place. I guess we've broken down what the definition of myopia is, right? We've talked about the impact of myopia. How do we make this conversation more mainstream? How do we make this conversation sexy? How do we get our eye care professionals to really sit down and have that real conversation? How do we make this magic happen? Because clearly you're doing a damn thing in your office, right? Now, I know
Yeah.
your secret sauce is definitely that lovely young lady that you're married to, and she's making all the magic happen. But you got to share some of the juice with us, man. We got to
Yeah.
learn a little bit more. So, how do we make it sexy? How do we make it mainstream?
Yeah, I don't mean to continue to go back to it, but it's that
Yeah.
definition is if you don't believe it, then you won't. But
Mm,
if you do truly believe it, there's no way you can avoid it. And we have been dealing with this problem for a long time, but this
yeah.
problem is getting worse and worse and worse. My mentor has a museum down in Oregon for eye care stuff, right? And in his museum of eyeglasses dating back hundreds of years, no myopic correction glasses, right? He can't find any myopic corrections. They're all hyperopic correction glasses. And it's because we are seeing this problem increase, over the pandemic alone. We saw a
Sure.
huge upswing in this, and you're seeing it in your practice. I'm seeing it in my practice.
Yeah.
The real aspect here of what we have to do to make myopia mainstream in our practice is believe that it's a problem and realize that the solution is not that complicated. The reality is finding the solution is not that complicated. What really was a big trigger for me, and I've been doing myopia management for 15 years, is when I was able to start implementing axial length into my practice. And Daryl, you see people with, on your podcast all the time with all the fancy widgets and gadgets and
Oh
so
yeah.
forth. And I'm that guy. I buy everything that's out there. Um, but I've come to a rule, and this is a good practice management rule that I really encourage all doctors to think of, is don't buy one instrument that can only do one thing from now on. Buy instruments that can do multiple things. And I wasn't going to buy an instrument that only did axial length. I needed to find something that could do multiple different things and replace something else in my office. And now we've got 3 or 4 of those that are on the market. For example, the Oculus Myopia Master does autorefraction and keratometry and axial length. There's a device called the Maya Topcon. It does topography and all this other stuff and axial length. So, when you're ready to buy a new instrument, buy something that has axial length. We should all be doing that within the next 5 years, as in when we started doing glaucoma, we started getting into OCT, and many of us have OCTs nowadays. That is what is going to really start setting you apart and really convincing you. The next thing is to realize how simple it is. And I'm going to challenge you, my man.
Yeah.
Here is a thing that I'm going to challenge you in. My site is super simple and
Yeah.
super easy. But what if I told you, do you fit multifocal contact lenses in your
I do.
practice? What if I told you that orthokeratology is as easy as fitting soft multifocal lenses? Here's some studies that show that with
Okay.
about 80 to 90% first fit success of the first 2 lenses that you put on the eye, that's better than my soft multifocal fit success, right? How often am I like, 2 lenses and then I'm done? But with 80 to 90% success of those first 2 lenses with most of the lenses on the market today. The other thing that I'm going to say is that our real big bit of success when it comes to myopia management is not vision correction. Good example, atropine, right? When we think about using atropine, we don't think about it being, something that's going to give the kid great vision. But for some reason, our expectation is that with any other treatment, it has to give the patient perfect vision. And the reality is that some of the best myopia management correction with ortho K or soft multifocals will actually decrease the crisp clarity of vision that a child will get. And so if we go into it with the expectation of perfect vision, we will not succeed very highly. And one of the best mindset changes that I had was sitting down with the parent and saying, we're going to do some things that'll slow down the progression of myopia. And there's a good chance we'll actually get them to see reasonably well. They may still need to wear glasses occasionally for refinement of their vision, which most nobody does because I have them at about 20/25 or better in most cases. But I celebrate 20/30 vision when I get it with myopia management with ortho K or a soft multifocal, right? And then we correct anything beyond that with glasses. But doctors think they have to have the vision perfect in order for it to be successful. And if that's the case, what they're really focusing on is the prescription, not the slowing of the myopia. And that's where our emphasis has to be. Take my kids, I'll be glad for them to have 20/25 vision if I can stop the progression of their myopia, right? When they become 16, that will change. And I'll start focusing really highly because I know that they're actually seeing a lot better at 20/25 than most kids that are out there anyway, right?
Absolutely. Absolutely. Man, you just dropped a lot of gems. I mean, oh my goodness. You're like a gold mine, a diamond mine. I mean, everything that you stated. I'm not gonna lie, man. I haven't heard it. I'll be honest, because the way you phrase it, the way you look at myopia control is completely different. I mean, to even say, this is not vision correction, no one's having that conversation,
No.
right? So that's a different twist on things. And something that I love that you stated, which we don't hear enough of, is in order to really make this mainstream, we got to believe.